Good morning or good afternoon or good evening, everybody. My name is Debbie. I am the Coloplast nurse specialist. My big background is a urology nurse specialist, but I also do a lot of work with bowel management as well. So some of you guys may have already watched the bowel webinar, and today we're going to do one on the bladder. Okay. So as I introduced myself as Debbie, and this here is...
Hi everyone, my name is Annalyn Paul and I'm the Health Promotion and Development Officer at SBHI.
So we'll just move on there to our slides. So sorry if I'm repeating myself here, but the last webinar we talked about the level of Spina Bifida and how it can affect the bladder and the bowel. So the severity of Spina Bifida really depends on a lot of things. So at the point of the spine, see my little arrow here, where the opening has happened and occurred when the baby is inside as a fetus, the size of the opening, whether there's skin over the affected area, and whether or not the spinal nerves are involved. And the spinal nerves probably are a big thing here, is because if the spinal nerves are involved, they often have an implication on your bladder and bowel function. So that's why we're going to talk about the bladder function today. There are two types of spina bifida, open and closed. Okay. So along your spinal cord, there's little fibers and bundles of fibers that come from your brain, run down your spinal cord, and are dispersed out then into different parts of your body. They're like little kind of pulses that pulse down the spine, and they send messages into the big muscles of your body. So say like your bladder, your bowel, your legs, things like that. So these fibers transmit electrical pulses of sensation to the brain via the spinal cord, and then they also transmit electrical pulse from the brain to the muscles and the organs. So what that does is it helps to contract your bladder and your bowel to contract to get wee and poo to come out. So the nervous system is split into two. So you've got your central nervous system and your peripheral nervous system, and they kind of coincide and work alongside each other to make them the bladder function work. Okay, so the kidneys in the bladder. Okay, so if you look here, first of all, you can see there's two kidneys on this picture. Most people in the world have two kidneys. Some people have three, some people have one, and you can totally live a normal, healthy, happy life with three kidneys or one kidney. Some people have two kidneys where one isn't working and one is. So this is just a snapshot of a picture, okay? And what the kidneys do is, for everything we eat and drink, they create they're filtering systems. So there's loads of little, if you think about it, like a sieve nearly, and it sieves out all the bad stuff, which makes urea, and then that mixed with water, we call that urine. So that's all the waste products of our body doesn't need, gets filtered through here, comes down these little tubes here, and then into the bladder. Okay, the bladder is a big muscle. Okay, and its job is to hold urine, but also to contract to get urine to empty out. But as we just discussed there quite quickly about the nerve fibers and how they fire off impulses into your bladder, in a spina bifida bladder, that mightn't happen. So the bladder isn't working the way we want it to work. And we can't leave it like that, because what happens is it'll reflux back up here into the kidneys and can start causing a little bit of kidney damage, and acute kidney injuries and things like that. So we're just very protective of the bladder, because we're really protecting the kidneys. So with men and women, the bladder function is the exact same in men and women. Where it differs is at the opening of your bladder, women and men have a very different urinary tract. So women's is about 5 to 4 centimeters long, and men's is a lot longer, is 18, or little boys and little girls, is about 18 to 22 centimeters in a man. As little boys grow, that lengthens. Okay, so that's why when you see different catheters, that they're all very different sizes, because one is for men and some are for women, and then it's just a matter of an assessment of what's the right product and things for you. So the role of the bladder, it's a muscle, a hollow muscle, formed as a sac, as I've already said that, and it stores urine. Okay, on average it's supposed to hold about 600 mils, so that's probably just the guts of 2 pints, maybe a little bit under. I'm bad at maths. And it's supposed to hold urine, and then when it gets very full, it contracts and pushes the urine out. And there's loads of different muscles in your bladder too. But I suppose with spina bifida, what happens is it's a neurogenic bladder we're dealing with. So the bladder doesn't do this contraction that we want it to do. So it may contract a little bit and the urine will empty out, or and leave a little bit behind, or it may not contract at all, or the contraction isn't strong enough to get the urine to be forced out of the body. And as we said, if the urine doesn't get forced out of the body, what happens is that reflux starts happening up into the kidneys, causing a bit of kidney damage. And then also the urine will start leaking out as well, which is just not a very nice thing to have to happen. So the lower urinary tract symptoms that we see a lot with spina bifida bladders is, number one, we kind of call it like an atonic bladder, and what that means is that the muscle just doesn't contract. So it just fills and fills and fills and fills and fills, but it just doesn't empty. And we can't leave the urine in the bladder, so we need to put in like catheters, or you're doing intermittent catheters. You may have a suprapubic an indwelling, a metrophanoff, which is a little port that you can catheterize through your belly button, or beside your belly button, sorry. And there's other things as well, okay? So that's how we manage like the neurogenic bladder that's not contracting. And then you can kind of have a bladder that does contract sometimes and then doesn't some other times. So, and those contractions are called an overactive bladder. It's when, rather than little contractions, they spasm loads and they basically make you wet. They force urine out of your bladder in a circumstance where you don't want it to come out. So say if you're in cinema or you're driving and you just get this contraction because it's not controlled by you, and it just makes your urine just push out of your body and you're wet, which is a horrible thing and nobody wants that. So that leads us on to urinary incontinence. So that's kind of like an overactive incontinence. Another type of incontinence we see is if your bladder has a lot of urine in it, or even a little bit of urine. And remember, everybody's bladder holds different amounts. But if your bladder is very full and if you're in a wheelchair, or maybe if you go to stand up and your bladder's full, it can leak urine because the pelvic floor can get quite weak as well from pressure and things like that. And then we have urinary urgency and frequency. So that's like maybe if you do void, and then meaning wee, and then you're like, God, I have to go back and go again, which is just not nice. So, and frequency then is maybe you could even self-catheterize and you say, I feel like I need to go again, or I'm wet again and I've only emptied my bladder. So there's medications and things you can be on for that. A big thing we talk about in the neurogenic bladder group is urinary tract infections, because anyone who works in urology, anyone who knows anything about a neurogenic bladder, we hate UTIs. You guys, everybody listening to this webinar would have had a UTI and they're horrible. Yeah, we can manage them with antibiotics and that's fine, but what can happen over time is they get really, really bad. You can get very sick. You can get like kidney urinary tract infections with them when they're higher up. They're the serious ones. They can lead to sepsis. So we're really, really vigilant about protecting your bladder to try and reduce this all the time, okay? And just because you've got spina bifida or hydrocephalus and you have a neurogenic bladder, yes, you are at higher risk of having UTIs, but if you're getting a lot of them, you should be, getting assessed as to why, okay? Because we just want to protect that upper tract all the time. So what I would always say when I meet people in this kind of group, like especially with spina bifida, is you should be under a urology service, okay? When you're a little kid, or any parents that are listening to this, if you're under the age of 16 or 17, I just can't remember which one it is, I said that the last time. Is it you're in Temple Street or Crumlin or CUH in Cork or services across the West? But when you get to that age, you then move into adulthood services. So there's a whole shift then where you should be transferred to see a urology service. So the likes of, say, maybe if you live in North Dublin, you were attending Temple Street your whole life, and then you will be transferred to either the Mater or maybe Beaumont, and that's kind of the way it works. You're under urology. And you really should be seeing every year to 18 months is kind of the gold standard. That can sometimes be stretched to 2 years because there is quite a reduced resources in our HSE. But you should be really seeing a urologist every 18 months to 2 years. And they may just see you, take some bloods, and you could have no problems at all, and you're tickety-boo. That's absolutely fantastic. But then if there is some issues, you really should be under a urology service. Diet and lifestyle is a huge part of your bladder management in spina bifida. Like, it's the most important thing. And Annalyn has done a lot of research and gives a very good overview of this, and she will do that after I stop talking. And then there's medications which a lot of you guys will be on. So we've got the likes of oxybutynin, Betmega, Vesitrum, Tobias. They're all different ones. There's so many out there. There's just to name a few. And what they do is they help smoothen that contraction that happens in the bladder and try make you more dry. Okay, just be careful with those medications because they can make your mouth very dry and your eyes very dry, and also they can make you a little bit constipated too. So they don't come without their, you know, difficulties, but they're very important to take as well. So we have intermittent catheters as well, which is something that I advocate a lot for. It's the gold standard for bladder emptying. Some people have indwelling catheters in, so they have leg bags, night bags, fifth flow valves, things like that. And anybody who wants to talk to me a little bit more about bladder management, please do reach out after this webinar. We share my details if you want to book into one of my clinics to see me or talk to me virtually. I know I've met an awful lot of you already. And just bear in mind that there's a combination of these treatments as well. It's not just usually one thing, it's usually a combination of things. So we'll highlight it there. We have diet and lifestyle. So I'm going to let Annalyn just take over here now to talk about lifestyle changes, bladder routine, and a little bit more about things like that. So on to you, Annalyn.
Thank you.
Yeah.
Sorry,
We'll just move that there. Great.
I think if I'm... Hi everyone, now let's focus on the lifestyle changes that can help manage and support better bladder health. Let's start with bladder routines. Schedule voiding. It is always better to follow a fixed schedule for urination while awake. The schedule voiding depends upon your health status, and normally it is between 3 to 4 hourly or recommended by your GP or urologist. Double voiding. It is a technique to help you empty your bladder fully. After passing urine, wait for a few seconds to a minute and then relax and try again to empty the last bits of urine from the bladder. Next is hydration and diet. Drink an adequate amount of fluids, 6 to 8 glasses of water daily, and limit the intake of fluids in the evening. Intake of a glass of cranberry juice every day helps to prevent urinary tract infections, which is one of the complications if you have neurogenic bladder. Kindly remember, if you have any kidney issues, take fluids as per the advice of your GP and do not drink cranberry juice or tablets or capsules if you are taking a blood thinning drugs such as warfarin or aspirin. Follow a balanced diet based on your health status and secondary conditions like diabetes, hypertension, and latex allergy. And intake of a high fiber diet is essential to prevent constipation, as straining can put pressure on your pelvic floor muscles, which can worsen the neurogenic bladder symptoms and trigger the occurrence of UTI. Maintain body weight. Being overweight can weaken your pelvic floor muscles. This can cause incontinence because of the pressure of fatty tissue on your bladder. So it is always better to consult a dietitian or nutritionist to form a diet plan based on your health condition. Limit certain foods and drinks. It is always better to limit caffeine, fizzy drinks, sugary drinks, and spicy foods. Caffeine irritates the bladder and can make incontinence worse. Try to cut down on alcohol and smoking, as it will increase the risk of incontinence. Now let's look at one of the effective management techniques, that is pelvic floor exercise, also known as Kegel exercise. This can be very effective if you have a neurogenic bladder. It can help both men and women gain more control over bladder problems by strengthening and tightening pelvic floor muscles. You may have to do pelvic floor exercises for 3 months before you see any benefits, but it is important to do them properly and ideally under the supervision of a continence advisor or physiotherapist. Hygienic practices are essential to prevent infections. So here are some key areas to focus on. Hand hygiene before and after toileting. Wash hands with mild soap and warm water. It is also very important to follow certain hygienic catheterization practices to prevent UTI, such as perform hand hygiene before and after catheterization, schedule voiding, use an appropriate catheter type, clean the site and sterile insertion of catheter without touching its tip, slowly empty the bladder completely and finally discard used items appropriately. Stoma care is also crucial. Make sure the stoma site is clean and healthy. Monitor for signs of infection daily, such as fever, discomfort or pain, redness or rashes, cloudy urine with increased odor, or blood in the urine. Make sure you clean the private area properly. Keep your private area clean and dry to prevent bacterial growth. Wipe your bottom from front to back when you go to the toilet. Promptly change nappies or incontinence pad if they are soiled. Wear clean underwear made of cotton rather than synthetic material such as nylon and change it daily. Also, avoid wearing tight clothing. Skincare management. It is important to prevent pressure sores as incontinence can trigger pressure ulcers. So, to prevent pressure sores and their complications, make sure you follow these things such as regularly changing your position, checking your skin every day for early signs and symptoms of pressure ulcers, keeping well hydrated, keeping skin clean and well moisturized. Finally, regular medical checkups. If you have a neurogenic bladder, it is advisable to undergo a urodynamics test if possible yearly. Also, regular prostate examination is vital, especially if you are over 50 years old, as an enlarged prostate can increase the risk of UTI.
Thanks so much, Annalyn. So that stuff is really, really valid, so important, but especially in relation to, as I had led to it, about the checkups, like just to be seen by urology. And that's a really good point about men, like over the age of 50, we do encourage that like, you're getting your prostate checked as well. And there's some medications you can go on as men as you age as well to help prevent lower urinary tract symptoms. So just briefly then, this is just a slide there about a couple of different indwelling catheters that we provide, Coloplast. I'm sure a lot of you are smiling here saying, oh yeah, I know this one, I know that one. So that's just a kind of a snapshot of the catheters that we use in Coloplast. But what I want to encourage anybody is, if you're doing self-admitting catheters, you don't have to be on any Coloplast, but you can be on any product. If you want to reach out to me, to have a chat with me, you know, things like if you're having a bit of discomfort putting the catheter in, if you're having UTIs, if you just feel like, you know, I'm using this catheter, is there anything newer on the market? Can I be, you know, it's anything at all. It doesn't have to be that you're on any of our products. It's not how we work. So we're just basically here to give you a free service and support. Because I do find over the years in my job, neurogenic bladders, especially Spina Bifida, it's kind of like no man's land, it's kind of lost, you know, you don't really know where you're supposed to go. So hopefully this webinar has helped give you a few little tips and tricks and a bit of advice on where to go with different kind of products and different areas of your bladder care. But please do reach out to me or to Annalyn. You know, we're here to help and we're here to support. And if you have any topics as well of webinars that you'd like me to cover in relation to bladder and bowel, like we just scratched the surface today, like if you want anything in more detail, please reach out. So yeah, thanks so much and have a lovely day, evening, nighttime, whenever you're watching this. Have a nice time.
Thank you so much for taking the time to listen to us today. If you have any questions or if you would like to learn more about self-management of neurogenic bladder or any other aspects of disease management, feel free to get in touch. I have included my contact details here and I would be more than happy to support you further. Thanks again.
Yeah, thanks a million, guys. Take care.
Bye.